around this room, and I know that the AMA is in great hands because of the diversity I see in here. There's gender diversity, there's specialty diversity, there's practice diversity. But also, as I look across this room, I see something that everybody has in common. We all have dreams. We all have dreams for the future of medicine. We have dreams for our practice. We have dreams for our family. We have dreams for our retirement. We all have dreams. Our patients also have dreams. And we sit in an incredibly privileged position to understand the dreams of our patients and to have an impact on those dreams. Another part of life is as we have these dreams, oftentimes we face impediments and obstacles. It is our privilege to be able to identify those in our patients and to do what we can to help them circumnavigate those. In the chaos of medicine as it exists today, sometimes we lose sight of that. And I want to spend the next couple of minutes to share a story with you, a story that brought me back to thinking about the dreams of our patients and how we have a positive effect in their lives every day. Let me introduce you to Maddie. Maddie's got this big Texas smile, delightful and bubbly as she can be. Great athlete. She loves to play basketball. If you're observant and you look at that left arm, you note that it's a little bit shorter than the right side. This picture was taken when she was 9. And as she's 10, it gets a little worse. As she's 11, it's a little worse. At 12 years of age, it was quite a significant cosmetic deformity. But more important to her was the fact that she couldn't do what she loved. She loved to play basketball, and this arm would no longer lift above this position. Couldn't shoot that jump shot any longer. And so she came to see us in orthopedics, and when you go to see an orthopedics, you do what orthopedics do, and we got a couple of x-rays, and this is what it looked like. Most in the room are probably not radiologists, so I'll help you out a bit. What you see, obviously, is a very shortened humerus up there, 8 inches or so. And if you look closely, that shoulder joint doesn't look quite right. And so we investigate that a little bit further with this 3D CT scan. And now we've identified the problem. The growth plate at the top end of that humerus had shut down. And it had shut down asymmetrically, so the medial side stopped growing while the lateral side continued to grow, rotating that into a 90-degree abducted position. And that deformity caused the greater tuberosity to be in such a position that the arm just wouldn't lift. That bone was bumping on the glenoid. 25 years of practice, I don't think I can remember a patient where the art and the science of medicine came together as we were trying to understand this girl's dreams and do what we could about them. Intellectually, it's pretty easy to know what to do. You simply have to rotate that proximal humeral segment 90 degrees. You need to stretch that bone out 8 inches and fill in a segment of bone to fill that gap. It's easy, right? Well, a couple of weeks and maybe a lot of thought later, we came up with a treatment plan for Maddie. Through that little incision in her upper arm, we went and made a specialized bone cut, leaving the periosteum so the bone could grow. We put an external fixator on her, the intention being to do just that, to rotate that upper segment, to stretch out that segment, again, in pursuit of her goals. So there we are at 2 weeks, and 3 weeks, and 4 weeks after your surgery. And you can see that, and it's in fact what's happening. We're stretching her out slowly but surely. And I have also, in my 25 years of practice, probably never seen a better demonstration of the human spirit. Somebody who came back to my office, and mind you, this is a 6-hour round trip back to my office every week, almost giddy, because she's seeing her arm become normal, week by week, looking at the x-rays and seeing that bone rotate. And so we're on to 6 weeks, and 7 weeks. At 8 weeks, I'm almost giddy because that proximal humeral segment, that shoulder joint, is now shaped just like it's supposed to be. The bone is lengthening just like it's supposed to. Now, I'm not going to pretend that I didn't get a little bit nervous doing this case. Here she is, and I'm really a little concerned. We've got this big gap. The bone's precisely where it needs to be, but I don't see much bone filling in that inner space. And so again, here's where the art comes in. We have to sort of slow down that distraction, let the osteoblast catch up, grow a little bit more bone. And in fact, we did that, and biology was our friend. You look closely and you'll see a nice sheet of bone that's forming in that interspace. And this case goes on, another month or so in the fixator, that bone consolidates, and then here we sit, 16 weeks after we started this journey. She's grown a new arm. Remember, one of our objectives here was that 8-inch length discrepancy. Now, recognize she's turned around here. It was the left arm that we were dealing with. You say, probe it, you idiot, you made it too long. I did. But I wasn't such an idiot because remember, the other side is still growing, so this was all planned out, and that was intentional. In fact, she ended up growing right where she was supposed to grow. Now what started this story? What started this story was this little girl with a dream to be with her friends, to be on the basketball team. She couldn't do that because of her willpower, because of 21st century medicine, but it was more the human spirit and a partnership between patient and physician that allowed her to realize her dreams. All in this room would agree that medicine is in chaos now. But inside of that chaos, we're looking at change and healthcare reform and this and the other. The one thing that cannot change, the one thing that should not change, is that relationship of understanding your patient's dreams, having a part in their life, and doing what you can to help them realize those dreams. Thank you for your attention, but more importantly, thank you what you do every day to help your patients realize their dreams.